I think up front, patients are very motivated. Obviously, the doctor, me, is also motivated to make sure we're not letting people slip behind with regard to toxicities. But once they get in that rhythm and they've been on it and they've been responding, you'll see what happens, right? You say, hey, I'm going to get you this scan in 6 weeks with a non-con CT scan just to make sure there's nothing going on. And by the time they see you, it's 8 weeks, 9 weeks, 10 weeks, and before you know it, it's a 3-month assessment, right? So our intentionality is, yeah, we should be careful monitoring these patients, especially early on. I think we are pretty good with it. But as life happens, people kind of slip, and you know, that rigor around getting the scans or getting the insurance approval in time, all those like real world things start happening, and you start losing that interim scan in some patients. So really, I think a lot of it is, it's nice to have to rely on diagnostics, but I think a lot of it is just talking, right? Talking to the patient, seeing if there's anything else going on, anything unexpected in terms of new fatigue, breathing issues, and just paying attention and not taking it for granted. So yeah, it's fascinating how patients can get, but also doctors can get. I don't want to use the word complacent, but there's a little bit of that, right? Is what's happening. People get into a rhythm.
Certainly, we always feel more comfortable, right? As you said, when they've been on it for a period of time, and you see that amazing response, and they're doing well. It is hard to motivate them to want to come in and get those CT scans, take the time off work, and do all that. So I'm right there with you. Sometimes it definitely is 3 months before we're getting those scans for sure.